The midterm review had in attendance legislators, including the chairman of the relevant committees on health in the Senate and the House of Representatives, the Office of the Vice President, ministers, diplomatic community, as well as development partners. At the end of the two-day meeting, key resolutions covered the following areas and actions we intend to take. 1, case management deficit. The course of action here is focused on having enough oxygen nationwide as the number of hospitalized persons increases. At the outset of this pandemic, we thought that ventilators were the things that were needed. But as we progress in case management, we realized that we need more of oxygen condensers to be provided in hospital environment. 2, testing deficit. The course of action is to establish one sample collection center per local government area. 3, strategy for high burden areas. The course of action here is focused on high burden local governments with precision interventions, including risk communication. 4, risk communication itself would increase community engagement, including engagement with religious and traditional rulers. 5, state ownership and collaboration. Here we would increase state ownership by increasing state engagement and collaboration, and also strengthen ownership at the state and local government levels now that we are at the stage of community transmission. 6, compliance on IPC measures. The course of action here is that we will institutionalize IPC policies in healthcare facilities and take steps to increase compliance of non-pharmaceutical measures, especially the use of masks in public places, hand washing and the use of hand sanitizers, and the observance of physical or social distancing. 7, private sector. We will continue to increase engagement with the private sector. 8, industrial development as a gain from the pandemic. In spite of the losses as a result of the pandemic, we believe that we need to support local production of PPEs and other critical supplies in the country. 9, movement post-easing of lockdowns. Here the course of action is communicating that anyone above 60 years or persons with morbidities such as hypertension, diabetes, autoimmune disorders, cancers, etc., should stay at home and avoid social events as they are at highest risk of infection and mortality. 10, government meetings and board meetings, as much as possible, should be conducted virtually until further notice, and all unnecessary travels for meetings by government officials should be suspended. 11, post-PTF national response. The course of action here is to develop an exit strategy beyond the life of the PTF, that is beyond September 2020. Underlying the above as a cross-cutting initiative is an enhanced risk communication strategy designed not only to educate the citizenry on the virulence of the virus and the individual and collective roles, that more importantly, to tackle the deliberate misinformation being bandied around especially in the social media. An enhanced risk communication strategy becomes inevitable when we realize that within the last 24 hours, the world witnessed the largest single-day cases of 230,370, while in Nigeria, the last week recorded the highest weekly fatality of 70 deaths. The rising fatalities in Nigeria is not unconnected with denial and delay in seeking help. You can see, in spite of the trillions of dollars that is invested worldwide, we recorded in a single day the highest number of cases since the outbreak of COVID-19. I will want to support the foregoing position with an insightful quote from Dr. Michael Ryan, the WHO Executive Director of Health Emergencies Program, on the rhetorics of denial and the need to take responsibility. See the projections, if you have put it on, where he said, I quote, "Every person needs to look at his own risk. You need to be aware of what is the local transmission. You need to know what the transmission in my area is. We do this every day in our lives as human beings." Can you increase the projection, please? We manage risk. We decide when we cross the road. We decide when we fly. Oftentimes when you wake up in the morning and you want to fly and you see that there is some bit of cloud and thundering, oftentimes you will not go to the airport. You will decide to shift your trip. We decide when we have an operation or not to have an operation. What we need is information to make those risk-based decisions. We need to gain the knowledge to be able to make good decisions. We decide on our proximity to other individuals. We decide on the intensity of our social engagement. We decide on how long we spend in that environment. We can be advised by government for all it takes. We can be advised by science, but in the end, it comes down to personal motivation and personal choice. But in the end, it comes down to individuals and it comes down to communities. If it does not feel safe, it is not safe for you. End of quote. The Presidential Task Force is also encouraged by the compliance messages that have gone viral on the social media. One of those that caught my attention gives 3 major reasons why COVID-19 is spreading fast, and it reads thus. A, they are my colleagues, so I can speak without a mask. I had that encounter yesterday with a friend who came to see me. That's B now. They are my close friends, so I can speak without a mask. I politely had to remind a friend who came to see me in the office yesterday, when he lowered his mask and I had my mask and my shield on, that he should put back his mask on top of his nose if he wanted to remain in my office and speak to me. C, they are my relations, so I can speak without a mask. These three situations presupposes that you are lowering your guard or ignoring basic danger. This message is so poignant that if we juxtapose it with the fact that crowded places and closed spaces create environment for the spread, we should behave more responsibly. I want to thank the author of the above and other related messages that I see on social media. As we progress in this phase and acknowledging that testing capacity has to be increased, we encourage as many Nigerians as possible to get tested. We have expanded the network of sample collection centers. In Abuja, a sample collection center has been set up at this day dawn, and all government hospitals in the FCT have been designated as sample collection centers. The Honorable Minister of Health will provide details in due course. Getting tested is the only sure way of making sure we know the prevalence of the virus and understand how to tackle it effectively. The visit of some media houses over the weekend to a Sokoro Observation Center and their interaction with some patients should give Nigerians the comfort to get tested and treated if necessary. As often repeated by the Presidential Task Force, contracting COVID-19 is not a death sentence, but not presenting yourself for testing or treatment when symptoms become observable could likely lead to avoidable death. Ladies and gentlemen, as you are aware, the domestic flights in the aviation sector have resumed. As at the last count, 6 of our airports, Lagos, Abuja, Kano, Owerri, Maiduguri, and Port Harcourt, have commenced operations. We wish to commend the aviation players for the measures put in place and hope that this would be sustained until we overcome the pandemic. The PTF has followed with keen interest the conversation around the resumption of schools. We recognize that our children are precious and we would not do anything to compromise their safety. The Presidential Task Force has assessed the circumstances and has put in place necessary guidelines to be followed, while the managers of the sector have the responsibility of drawing up the protocols and determining the dates. We urge Nigerians to follow closely the critical steps being taken by the Federal Ministry of Education in conjunction with other stakeholders. Further to this, the Federal Ministry of Education has released guidelines for schools and learning facilities reopening after COVID-19 pandemic closure. The guidelines clearly spell out major things to consider before schools and learning facilities shall reopen: the reopening process, sequencing and scheduling of safe reopening, and decisions about schools reopening. The Minister of State for Education will elaborate on this. The Presidential Task Force recognizes the efforts of our innovators, researchers, and research institutions in working to get a solution to COVID-19, especially its cure. However, we refrain from misleading the public into believing that a cure has been found or certified when indeed the validation processes is still ongoing. This call is necessitated by the recent publication that a cure for COVID-19 had been listed by NAFDAC. The agency has debunked the claim, and we advise Nigerians to be vigilant. In furtherance of the partnership we have built, Nigeria received $8 million worth of PPEs from the government of Germany and the ECOWAS Commission over the weekend. Also in line with Mr. President's role of the ECOWAS COVID-19 champion, Nigeria provided the warehouse space and shall support with the logistics of delivering the materials to other ECOWAS member countries. The Presidential Task Force would like to use this opportunity to thank the government and the people of the Federal Republic of Germany and the Economic Commission of West African States. I must not close without reiterating the need for all of us to remain conscious of the fight before us. The pandemic would not go away by wishing, neither would it go away if we refuse to keep safe. Please, let's all resolve to play our part. While government does its best to save lives and livelihood, to this end, the PTF wishes to reiterate the following. All government offices shall continue to hold virtual meetings in their offices, especially where participants exceed 4 persons, and they should also suspend unnecessary travels for meetings. 2, for corporate organizations, board meetings, etc., the reopening of the domestic flights should not be misconstrued. The PTF strongly encourages virtual meetings as well. 3, we still urge places of worship to cautiously follow the guidelines on public gatherings. And 4, we would urge members of the political class, particularly in states where elections are scheduled in the months of September and October, to exercise utmost circumspection in their gatherings for whatever reasons. I now invite the Honorable Minister of Health, as well as the Director General, Nigerian Center for Disease Control, and the National Coordinator to give you updates after the Honorable Minister of Health, and thereafter other ministers will follow subsequently. I thank you for listening.